Meet Alex. She is a 24-year-old university graduate student and spends most of her days doing office work and holding meetings with her coworkers. On weekends, she likes to go out with her friends or her boyfriend, and during her downtime, she reads books and plays with her dog. To most, she seems like an ordinary woman. However, sometimes, especially in moments of stress, she'll blurt out an inappropriate word or blink very aggressively, which throws people off. This is due to a neurological disorder called Tourette syndrome. Tourette syndrome, or TS, is a childhood onset disorder that is characterized by sudden and mostly uncontrolled movements and vocalizations called tics. Tics can have differing degrees of intensity and frequency with unpredictable durations. They can be simple or complex and characterized as being motor or phonic. Examples of motor tics include head jerking, facial grimacing, and clapping. And examples of phonic tics include throat clearing, grunting, and repetition of words. TS is often associated with other comorbidities such as attention deficit hyperactivity, or ADHD, obsessive compulsive disorder, or OCD, anxiety, and depression. Tourette syndrome is diagnosed mainly in children around the ages of 5 to 7. In order to be diagnosed with Tourette's, they must present multiple motor tics and one or more phonic tics for over a year before the age of 18, and the tics cannot be explained by any other medical condition. Tics are most severe between the ages of 10 and 12, but they improve with age and are reduced by adulthood. Alex experienced her first tic, a pig sound, at 8 years old while watching a movie with her family, and her tics were at their absolute worst around 12. Alex also suffers from severe ADHD. She was diagnosed at the age of 10 and was prescribed stimulants. The stimulants helped improve her ADHD symptoms, but worsened her tics, and therefore she had to stop taking them. It took her years to find the appropriate drugs to treat both her tics and ADHD, and unfortunately she still suffers from many side effects when taking them. The cause of Tourette syndrome is not really known. However, there are some hypotheses that dopamine plays a role. It is thought that overactivity in dopamine neurotransmission leads to tics based on the fact that dopamine receptor blockers and dopamine depleting drugs have been shown to be the most effective in suppressing tics. On the other hand, agents that increase dopamine activity or increase dopamine levels in the brain worsen tics. It is also thought that TS may be a genetically heterogeneous disorder. Nevertheless, the precise neuroanatomical location and mechanisms underlying TS remain unknown, making it hard to find proper treatment. Pharmacological agents are not super reliable for improving tics and are associated with many adverse effects. In general, pharmacological agents can reduce tic symptoms by about 50%. Typical antipsychotic drugs, such as haloperidol, pimoside, and flufenazide, which are dopamine receptor antagonists, have been shown to have the greatest efficacy, but are associated with serious side effects and therefore are usually not the first-line treatment. For example, some side effects include sedation, impaired cognition, weight gain, tardive movement disorders, and cardiac arrhythmias. Atypical antipsychotic drugs, which are dopamine and serotonin receptor antagonists, have fewer side effects. Other agents, including clonidine and guanfacine, have been shown to moderately reduce tic severity, but are much better tolerated in addition to improving ADHD in patients with TS. These are usually the first-line treatment. In general, treating patients who also have other comorbid conditions such as OCD or ADHD, like Alex, is even harder due to adverse effects and contraindications. Therefore, many patients have to discontinue the treatment. In addition to pharmacological treatment, behavioral therapy has also been put into place to help patients manage their TS symptoms. It has shown to be extremely effective in reducing tics in many TS patients. There is still so much unknown about Tourette syndrome, especially because it is so hard to diagnose. Nonetheless, science is always adapting and moving forward. So if you ever meet someone like Alex, hopefully you will understand a little more about what they are going through and maybe offer them support.